Now please welcome President and CEO of Anthem, Gail K. Boudreaux. President and CEO of Blue Cross Blue Shield of Arizona, Pam Cahaley. With their moderator, co-founder and CEO of OODA Health, Giovanni Colella.
Okay. Before we get started, I just want to take 30 seconds to say thank you to two wonderful women leaders. I'm humbled to be on stage with you. Two women that I've followed in my career, and I've seen them take a lot of setbacks and a lot of tough moments, and your drive brought you to be the leaders you are today. Our children are going to grow up in a better society because of women like you. And I ask all of you to give a round of applause just for who you are today. Please, come on, join me in this. Thank you. With all that, let's start. We have a video. Let's start with the video because I think it set the stage for what we want to talk about today. Let's go with the video. Is that possible?
I went to Mercy Gilbert because I had the flu and I had a 103-degree temperature.
My son was having abdomen pains and we had brought him to the emergency room to make sure that everything was okay. The bill that I had received was actually very accurate.
Every single claim from my visit at Mercy Gilbert is on one bill.
We knew that if we could not pay that bill, that we could go directly to a website or we could go directly to a phone number and talk to somebody. We're able to really understand our insurance more than we ever have.
I did call in to your call center specifically to just set up an automatic payment plan, and I spoke with Monica and she was so nice, and it's just basically this whole entire experience has been extremely positive. This new billing platform should be the standard for every single insurance carrier. I think it is literally going to change so many people's lives.
Terrific. People excited about getting a bill from a health plan? That's fantastic. So Pam, let's start with you, given that they quoted Arizona there. So I have a couple of questions. Let's start with, how is your organization working in order to improve the member experience?
So the member experience is, I think in order to really know what to do to improve the member experience, you have to ask members what they want. And I've spent a lot of my career chasing things that are bright and shiny that we build and that they really don't want. So we're actually going to be partnering with the USC Schaefer Center for Health Policy and going to do some extensive research to understand what members do want and also what they're willing to trade off for affordability. But there's a Deloitte study out that I would recommend, if you have not seen this, you take a look at it, because it ranks, it surveys consumers, and they have to rank the transactions that occur in the health ecosystem from what's most important to what's least important. And the most important on the list is not surprising, it's your interaction with your doctor. And it's people, the number one thing they want is somebody, a doctor that will listen to them and spend time with them. And that's the number one thing. But number 16 on that list, to your question specifically, number 16 on that list, so again, a list of 1 to 64, so 16 is pretty high, important to members, is they want a clear and accurate, simple, easy to understand bill from their provider and an explanation of benefits from their insurance carrier. That's number 16. And so this is a huge pain point for members and for patients. And in fact, if you're a hospital administrator, you probably know this, the Net Promoter Score for somebody that's in your hospital runs really, really high while they're in the hospital. They love the nurses, they love the food, but when they get home and then they get the bill, that Net Promoter Score plummets because it's so confusing. So we, recognizing the importance of this transaction in the health channel, we partnered with OODA and with Dignity Health and looked to really change that dynamic. So now what happens, we started this pilot at the beginning of this year. Now when a Blue Cross Blue Shield of Arizona customer or a member goes to a Dignity provider in Arizona, they get their services and they just go home. Then Dignity suppresses their bill. We suppress our explanation of benefits. We send the full amount of money payable to Dignity right away, really fast. So they get not only the health plan liability payment, but they get the member liability payment, so the deductible or the co-insurance or the copay. So Dignity's done. They've got their full payment right away. And then OODA creates one document, a comprehensive health statement that outlines the services, the amount, how much the insurance company paid, and then what's left for the member to pay. So they get one document. They don't have to figure out, reconciling the explanation of benefits and the bill. They get one. And this is one of those situations where it's win-win-win. The members that you saw up there are real Blue Cross Blue Shield of Arizona members that went through this experience. They love it because it's easy. The Dignity loves it because, number one, they have a happy customer, it maintains that happiness level, and they get their money right away. They get out of the collections business. And I love it as an insurance carrier or company because, again, my customer's happy, and I have fewer calls coming into my call center. People calling and saying, what is this? I've got these different things, they don't match. So it's a great example of improving the member experience through collaborative disruption. All parties coming together and tackling something that's important to the consumer.
Thank you, Pam. And Gail, you have a national scale.
That's right.
You improve member experience, you improve Americans' member experience. So how is your organization? Because national scale, by the way, also means a lot of complexity, working through things. And, you've taken on Anthem, what is it now, almost 2 years, right? So
that's right.
Major changes. How is Anthem dealing with the member experience and innovation and those kind of things?
Sure. And first, actually what Pam said, I think, is a great overview of how we think about it, too. And I would just add a couple of key things. One, personal, simple, and predictable. As we think about how we're dealing with this, Giovanni, and what Pam said, I think is really important, is whatever we do, whether it's in our space around consumer engagement or how we work with care providers, we're trying to figure out how to simplify it. You said it very clearly. We have lots of different interactions, lots of different rules, things that we have to do based on our different types of business, whether it's Medicare or Medicaid or commercial business. And our first goal has to be to take data and technology, similar to the example we just saw, and use it to inform us on how to simplify our processes, what's working and what's not. And so we are working really hard on that. We're using AI in particular to help us find predictive models, over 300 predictive models about when things can happen, when calls may come in because something in the infrastructure of healthcare isn't working. And to me, that's the great promise. So I love the opportunity to be able to simplify through consumer engagement tools, which many of us have worked on and I think are doing quite a bit of work, but to use AI and data now to dramatically change how we're attacking and trying to solve these problems. And then I think the last one, and you said it, which was perfect, is our Net Promoter Scores seem really strong when we're engaging. When consumers have an issue, they're in the hospital or they work with our care managers, but then they get frustrated. They get frustrated because they get a bill that doesn't align necessarily with the care that they had, and then they end up either in a collection nightmare, and quite frankly, we get frustrated because we spend a lot of energy and resources around our plans tracking that down. I think there's a huge opportunity for us to take the consumer out of the middle and quite frankly, the care provider out of the middle. So to answer your question, that predictability I think is the real magic for all of us in the system. is so that consumers know exactly, and I think the example that we just saw in this video is having a consumer have a very predictable financial experience that goes with their clinical and healthcare experience is important. And then the care providers, they spend an incredible amount of time chasing payments, not having certainty in their financial cash flow streams, and there's a great example there. So in terms of the solutions, we're obviously doing some of this same work, and we're also, I don't think there's a single solution to it, so we're investing and trying a lot of different things, and our overall philosophy is there are great ideas everywhere, and we believe in an open ecosystem, so that really honestly being able to plug and play that and trying to find how we take costs out of the system, but quite frankly simplify the system for consumers.
That's terrific. So talking about cost, given that when you talk about the healthcare equation, cost is always there, no matter what, and it's the right thing to do. I have some numbers here that come from JAMA. So the total cost of waste, it's between 800 billion to $1 trillion, okay, of waste, of which about 300 billion is just in administrative waste, right? That's the GDP of a small country that we're wasting in administrative expenses. And there's a lot of political talk now about Medicare for all and things like that, where, to be fair, the administrative cost probably would come down. So actually, this time I'll start with you, Gail, because that impacts you. So how are you thinking of the whole administrative piece, and what are the things that we should put in place?
Yeah, so I think it goes back to my prior answer, because I don't think they are separate. I think we can improve the consumer experience, we can improve the cost structure. And I'll give you a few quick examples. You know, we're building a platform called Sydney. Sydney essentially takes all of the information that you need, both from clinical, financial, engagement, and puts it together in an easy way for consumers to make decisions. So why is that valuable? I think it's valuable because then our relationship with our care providers also has that information and data. And so care providers, through our integrated personal family health record, can see the same thing that consumers are seeing. So we're not looking at duplication of tests. We're trying to also reimburse on a pay-for-value basis. And I think what makes it great for like Anthem, as well as I think all of our Blue partners, is that we have, we serve 1 in 3 Americans in this country. And the density of someone coming through a care provider's office is generally 1 in 3 or 1 in 4 of those patients carry a Blue Cross and Blue Shield card. So our opportunity is to align and link. And what we're trying to do is make sure that the way that we're working on our pay-for-value contracting relationships with care providers, and then the tools that they have are fueled by the information. So again, using AI and other types of tools to help us understand, better predictive algorithms for those care providers, launching an integrated patient record so that the patient can have all of their data. They can have the CMS Blue Button data, they can take the wearable data, and they can have it all in one source and give their care providers access to that. And then third, that consumers have tools that they'll use. Because we've had tools for a long time, we haven't seen the level of engagement that we really need. And I think the real magic here, and to get costs out of the system and also, quite frankly, to improve outcomes, is to have the integration of those 3 tools. And I feel good about what we can do, quite frankly, as a Blue family, because of just the volume of patients that we see across our markets. And that's a big opportunity. So.
Terrific. Really gratifying is I hear 2 things very important. One is we're taking cost out of the system, the real cost. I mean, we're not just squeezing care. We're taking the cost that we shouldn't have in the system. And the second thing you said is this will benefit all the Blues. And let me turn to you. So first, same question. In Arizona, the good thing is you have a strong, massive presence, so you can actually drive behavior there right away. How are you thinking of taking administrative cost out? And then we'll get to that too. I would love to hear how you think of leveraging some of the things. The Blues world, the big advantage, you have 110 million lives. The bad thing is like managing the European Union, right? It's, there's a lot of going back and forth. And so, and Anthem is, we don't want Brexit. And Anthem is a driving force in that. So how are you leveraging some of that? Let's get to both of those questions.
So when I think about administrative waste, I think about administrative complexity, and it's the complexity of the system that really drives the waste. I was going through old files like 10 years ago, and I found evidence of coverage from the late 60s. It was 2 pages long. Today, our evidence of coverage documents are over 100 pages. I can't imagine, could you imagine buying any product where you get a 100-page instruction manual? No pictures, just all words. It's just, we've made it so complicated. And so, to your point, removing that complication, it's not withholding care, it's not saving money by not giving people the right care at the right time at the right place. It's moving things that really don't make sense out of the system. So a focus on that, and I would say I really liked what you were saying and would love to maybe buy that from you, but
we'll sell.
Yeah, I'm sure. But from our perspective, in order to remove administrative complexity, you have to do it in partnership with the delivery system. We can't do it on our own. So I think it's a lot about creating those value-based arrangements with providers. And when I say value, it's not just medical value, it's a whole experience. And so you can impact the whole experience when you have a different relationship with the delivery system than we have today.
Yeah, I'd love to give a real tangible example, because I was listening to Bernard before we came on, and I think what he was sharing was this concept of whole person health, which we just so fundamentally believe is the right platform. And one great example is that as part of our whole health focus, we look to share data between not only medical practitioners, but also dentists and optometrists. And one example of the ability to share that data, so while not focused on administrative expense, but focused on reducing total costs, as part of that, we know that we have been able to reduce opioid use by almost 50% by training our dentists. We looked at across our book of business and found that our opioid prescriptions, at least 10% were coming from dentists. And many of them were more than 7 days in terms of the length of the prescription. We were able to reduce by educating dentists from what we looked at our total database and looking at sort of a whole health person. So as opposed to just saying we're only going to look at our physicians and how do we improve overall prescription usage around physicians, that we would actually look at our vision providers, our dentists, and we were able to reduce the 7-day prescriptions by 90%. So the great example of that is it's a huge, obviously, social issue. It's an area of important focus for all of us, but more importantly, we're able to take that data and information and I think reduce waste in the system, because many of those prescriptions were unnecessary for that period of time, but also improve outcomes in an important area. And similarly doing this with our ophthalmologists, because we're also noticing that there's a huge interaction between certain drugs and vision care. And we're able to now use that data and share it with our dentists, our ophthalmologists, and our medical providers, and now we're integrating it into how we pay them. So to me, that's a great example of the opportunity to use informatics and data, and quite frankly, artificial intelligence to identify themes that are occurring across this massive data set, and then be able to develop programs and have an impact on what's going on in terms of people's health and outcomes. So not administrative expense, but quite frankly, we couldn't do that as efficiently before without some of the tools that we have today.
Well, and that's a big social mission too. I mean,
right.
We have an epidemic now, and you're in a good position to help stop that. So getting on, I mean, my goal is also to ask challenging questions. So we at OODA, we sit in the middle between you and the provider, and it's a privilege, but we hear still a lot of distrust. So I'm giving you my data. What is the health plan going to do with it? So Pam, what do you think about what can we do to break this war between, there was a real weaponization of the relationship, and I understand that now there's a lot of goodwill. What can we do to make that improve?
Well, I think it really is about changing the relationship between an insurer and a provider. Currently, I think we do a lot of self-congratulatory patting for the number of providers that we have value-based arrangements with. And in Arizona, we say we have well over 50% of our providers are on a value-based contract with us. And that sounds great, but when it comes right down to it, you look at the compensation, less than 10% of a provider's compensation comes from value-based care. That means 90% is still fee-for-service, and that isn't how you really develop a partnership and change behavior. So I think what we're looking at in Arizona is how do we really advance that partnership so that we truly are aligned around value and outcomes? And that's a very different kind of a conversation with a provider partner than, you know, here's a value-based contract, sign it, and we're going to pay you a little when you hit these metrics. So I think in order for us to make true changes to the system that need to be changed, it has to be the provider delivery partner and the insurer sitting down and having a completely different dialogue than we have been having for the past decade.
Gil,
I think Pam hit it. I mean, I think we are more enlightened, maybe, and Giovanni and I, our early days were more antagonistic in terms of you're trying to change healthcare and our view of it. But I think what we've come to know is that there's no single silver bullet that's going to do the kind of things that we have to do. And that, yes, we have, again, I'm going to go back to data and an open ecosystem. And as we think about an open ecosystem, there's a lot of great ideas, and we should welcome them. I mean, I believe we should really be looking at, we haven't solved the issue of 90% of GDP is still going to healthcare, that our outcomes are nowhere near the level that we need them to be at. That we are moving to value-based care, but I agree with Pam that a lot of our value-based care is not changing outcomes yet, and it's still not the majority of how they're paid. And our goal is to move it to really be a much more risk-based value-based care, so upside, downside risk, where that care providers are really aligned and incented, and then we can use our information and our data to take away the things like pre-certifications and pre-authorizations and things that don't add value. And then I think our other opportunity, and this goes back to your other question, is really all across the industry, we have a huge opportunity to standardize. And I would say that yes, we could standardize on the data elements around value-based care for 80%, and then based on local market conditions or where we are in terms of unique relationships with care providers, that if we could do that, that would simplify both the payer side as well as the care providers. So I think there's a big opportunity, Giovanni, and I think that we are more enlightened about information should drive our decisions, and we have better tools to do that, and we need to keep an open ecosystem. So I think some of the historic antagonism really doesn't work because we're not solving the problem.
Mm-hmm. And the fact that we're sitting here all together, the three of us, proves that you're able to get over some of the historical antagonism.
We can.
And so on that note, let's move to something else then. How are health plans thinking of innovation per se from a technology standpoint? So, Gil, let's start. I'm just picking because she brought up the fact that in the past how do you work with innovators, and do you really believe that the health plan, or do you believe that the health plan can do it all on their own?
Yeah, so I think it's a great question, and I absolutely believe we are betting heavily on innovation. Many of you who were here Saturday know our digital and AI team. We have a chief digital officer that we've hired over the last 2 years. We have a embedded team. We ran the hackathon on diabetes between Saturday and Sunday. And we are, again, it's the concept of open ecosystem innovation. And I think for us, it's taking this vast resource of data and information that's historically been claim-based, but now bringing in lots of other information, as I said, wearable information, CMS Blue Button data, and really using that to create something distinctive. And so I see innovation in kind of three ways. We can use our data, AI, we're innovating around blockchain because I think that's one of the great opportunities for us to improve trust across healthcare. But there's process innovation. So how do we take our historically manually intensive process, even what we're talking about claim payment, pre-certification, clinical rules, and be able to predict ahead of time what those should be and really reduce the administrative burden. I think some of the other innovation that's going on right now around wearables and how do we integrate clinical data, how do we work with some of the most, the sickest population, the top 5%, how do we use the information and data and monitoring them and improve their healthcare outcomes. So we're sort of innovating in three spaces. Some of that's inside of our own organization, and a lot of it's with small companies and small entrepreneurs who have great ideas that we want to, as a big company, we have to be very careful, that we follow the rules around data rights and rules and privacy, but also sort of unleash this incredible talent that exists with an infrastructure and a team that can innovate again around process, around clinical goals, and around outcomes. So I'm actually really excited about it because I think there's so much potential for us, and it's a mindset too that we have to be willing to let others innovate with us, and so that's kind of how we're approaching it. But again, it's pretty new for all of us in the space, so we've got to be able to demonstrate that there's really fruitful and profitable outcomes for everybody. But I think we're in a great spot to innovate.
Great. It is very exciting. Pam, for example, we've been working quite closely with your team and things like that. How do you think about working with companies that are smaller and innovative and working with you and interacting?
Well, it's been a great experience for us and a real eye-opener for me. You can imagine if I looked at the problem of complicated EOBs and bills, and I thought, as an insurance company, I'm going to fix this. I could spend a lot of money on a consultant to come in and look at my EOBs and rewrite them at the 6th grade level and put nice blue boxes around and make it easier to understand. And then the provider could separately be doing the same kind of effort. It's still the same problem. They might look better. We spent a lot of money thinking we're solving the problem, but having you come in and pulling that together so that we're working together on the issue. And it goes back to my earlier statement, we can't do it alone. We have to do it with the delivery system and with the vendor to help kind of just pull it all together. So I think that's a really good example of why it's so important to pull in all parties to drive that collaborative but disruptive change.
And can I add one more thing, Giovanni, because Pam made me think of also, I think the challenge, and I'll go back to what we were just talking about, the integration and whole person health, is that right now I think our challenge is innovation is happening, but it's still point solutions. So we've got to be able to figure out, especially as a payer, and I think quite frankly for the consumer, how do you integrate the point solutions? Because the point solutions by themselves may do something good, but they don't do enough. And so I think that's the biggest challenge we have, and as I know many of you out there are working on those, we really need to be able to think holistically about consumers and clinical issues and processes, and not just be putting things in and plugging them. So while I talk about an ecosystem, that ecosystem has to work together, and I think there's a lot of opportunity for us to do a better job at that.
I think that is such a good point. I just, when I've spent so much of my career looking at these little solutions that handle a very specific problem. It's, your right pinky on a Monday when the moon is full kind of thing. But when you, and that might make sense, but a consumer doesn't want to have to pick a lot of different things to try to address their issues. They want one integrated platform that's easy to use, simple and intuitive, and they want it all connected. They don't want to have to go to lots of different
That's
places.
what they get in every other industry. And by the way, on the other side, the provider wants the same too.
That's right.
The provider doesn't want to have to do tons of things.
Right.
One thing we've learned as entrepreneurs is, this is a team sport. It really is a team sport. And the complexity of what you guys are handling is something totally new to us too.
Right.
And that's, so that's something where we really want to thank you for how much effort you've put in from the top through the entire organization. Which brings me to probably the last question here before we have to get up. And by the way, I'm going to get up last because I don't want to go out next to the two of you. My height is embarrassing. But the hiring, I mean, it's like, Gail, you've hired some amazing people that I would have never thought would work for health plans. How do you do that?
We're a great place to work.
You're a great place to work. How?
I think part of it is obviously we're dedicated to it. We put resources in it, and it's a really interesting space. I mean, all of you work in healthcare. We have huge problems to solve, and I think we've been really blessed to be able to hire some incredibly talented people who've worked, across the space on things that are not health related, and now see as an opportunity to work with big data sets in a company that's really committed to making a difference in healthcare. And our mission is improving lives and communities, simplifying healthcare, and expecting more. And I'll go back to that expecting more because that's really where I think the huge opportunity is. And we are very much honestly, from our roots as a a passion-driven company that also is tied to performance. And I feel we haven't had trouble hiring people because they can feel it. They can really see the connection, and we've spent a lot of time on mission, vision, values, and culture. And I think culture is really important. And again, you said it's a team sport. I agree it's a team sport, but I also believe you have to have it as a personal experience at scale, and that's what makes it really hard. And we can work at scale as well as try to make it personal.
You hammered that in me before we even started OODA. I remember we were at Dartmouth and you think scale, think scale.
Think scale.
Now, Pam, you recruited some great people. You
Yeah.
recruited them out of Anthem.
Well,
That's why.
Sorry. Yes, amazing. I've got the most incredible team. And what really motivates us is that, and I think everybody in this room right now, we have the opportunity to really drive positive change in the healthcare system. And I think we all are going to be able to look back 10 years from now and say, you know, I had a handprint in that. I did something really great. The industry is just waiting for that change, and we're going through it, but you know, it's going to be significant, and it motivates myself and my whole team that we can be the drivers of that really positive change.
Yeah, it is an unbelievable moment, and they're telling us we are almost done, but it's like, and at my age, you don't look 10 years ahead anymore, but I could say just today, it's an unbelievable moment. And I want to thank you.
Thank you.
Because one of the reasons I think people come to your companies is because of the two of you. I really do believe that. So I want to thank you very much for. Are we still? You're giving us a couple more seconds.
To get off the stage.
To get off stage.
I think that's for us to get off the stage, so
Yeah, that's
thank you,
the
Giovanni.
signal, yes.
Thank you, Gio.
And never ask an Italian to make a long story short, right?
Thank you.
Okay, you get up first.